Hi. So today I'm talking about the Lyme vaccine just because I happen to think it's interesting. And here in Indiana, we're kind of in a unique place where the tick and the disease is endemic, but not in crazy amounts. So for the presentation, I'm going to go over Lyme disease briefly, but it's not the focus. Then I'm going to get into the vaccine, why it's a bit controversial, the mechanism, and decision making, because this is a management class. So Lyme disease, proliferation and transmission. So Lyme disease is a vector-borne disease, and it's carried by the deer tick. It's a bacterium known as Borrelia burgdorferi, and it's transmitted 12 to 24 hours after the deer tick bites a host. And it is zoonotic in the sense that if your dog brings a tick into the house, the tick can then bite you and give you the disease, but it's not transmitted from an infected animal to an uninfected animal via fluids, saliva, or blood or anything. And it is endemic in New England and the northern Midwest, so dark blue on this map. So there's a 1.1% in Indiana of seropositive dogs, and the range in the Midwest is anywhere from 0 to 18% in Wisconsin. And in New England, it ranges from 7 to 19%, with 12.8 being the median. So it's a lot higher out there. Any unvaccinated dog is almost guaranteed to get it in New England. So the symptoms and prognoses. Everyone knows the bullseye rash. That's pretty much its calling card. Additional acute symptoms are fever, lethargy, arthritis, swollen lymph nodes, and that rash. And if you can catch it soon enough, then the prognosis is excellent. And then chronic symptoms are cardiac changes, neurologic signs, but the big ones are arthritis and Lyme nephritis. And for those, the prognosis is a lot worse. Really, you have a couple options. The first and best option for handling it is prevention. You can do that by avoiding infested areas. For the deer tick, or for most ticks, it happens to be unmanaged areas, so forest, brush, and fields. Although there's some new ticks coming into the United States that have been found in front lawns, so really that's not going to work anymore. Habitat management, so keeping your yard and any places you visit clean, checking your animal frequently, and removing the ticks promptly and properly. Vaccination, topical treatments, and collars are the more chemical prevention methods. And then for diagnosis, you can do a SNAP test that tests for the antibodies formed in your dog against the Lyme C6 peptide, but those can present false positives. So additionally, you need to check for clinical signs and protein presence in urine. And for an acute test, usually if they test positive but aren't showing clinical signs, or if they're showing clinical signs but not really chronic ones, just antibiotics will usually clear it up within 2 to 3 days, but then they're continued for several weeks afterwards. For chronic treatment of chronic Lyme, you need to monitor and really check everything having to do with their kidneys, but if Lyme nephritis sets in, really your only option is to improve quality of life as best you can, but it is fatal. So the controversy with the vaccine is that if you Google Lyme vaccine, the first 10 links will be, don't get it, why should I get it, you probably shouldn't get it. And that's because they say the vaccine is not as effective as other canine vaccines. This is somewhat true. Mostly because the efficacy of the vaccine depends heavily on adherence to strict vaccination protocols. So 2 initial doses, 2 to 4 weeks apart, followed by annual boosters. And so really the vaccine doesn't perform its best until you get the 3rd vaccine. And then they say it doesn't last as long as other vaccines. There is an inconsistency across animals having received it, and some will show a short duration and some will show an annual duration. And they say it's not as safe as other vaccines. This one is true. So Lyme vaccines produce adverse effects more frequently than any other canine vaccine. And that's because the antigens produce the circulating immune complexes that may lead to Lyme nephritis, especially in predisposed dog breeds. Those are Labrador and Golden Retrievers. So the reason its effectiveness is kind of wonky is because the antigens used to produce the vaccine are outer surface protein A, so that's OSPA here. And as you can see in the picture, OSPA is expressed while in the tick, and then during transmission it tapers down and it isn't present in the dog. So if you're giving a dog a vaccine made from outer surface protein A, it's not actually going to do anything if the bacterium is actually present within the dog, which is kind of interesting. So what it does instead is when the tick takes its blood meal, it actually kills the bacterium within the tick mid-gut. But as soon as the tick starts drinking the blood, it downregulates the outer surface protein A and starts upregulating protein C. And that one is really difficult to make a vaccine for because there are dozens of different types of outer surface protein C. So if you make a vaccine for one, it won't work for all. And if you make one for all, it will generally only work for one. And outer surface protein F is, it indicates a chronic infection, and by then it's kind of too late. So these are the vaccines that are currently available. If you look on the list, you'll see most, or all of them are outer surface protein A, so they kind of vaccinate the inside of the tick's gut, and outer surface protein C, but again, it really depends on the individual and the geographic location. And then in the chart on the right, you have the presence of those outer surface proteins with respect to time. So during infection, you won't have any C or F, you just have mostly A. And during transmission, A goes away and C is upregulated. And during a chronic infection, if you test for titer for antibodies for proteins A and C, you won't get anything, but you will get F. So how this relates to animal health management is that every dog owner needs to make a decision whether they will or will not get the Lyme vaccine. And so really you can ask a couple of questions to determine the answer. What is the risk of infection is probably the most important one, but it depends on the season and the geographical location. So if you live in Montana, there's no point in getting the vaccine at all, but if you live in Massachusetts, you really should 100% get it. But I'm not telling you how to live your life, so. How severe or damaging is the disease? So acute Lyme disease, easy fix, but chronic Lyme disease, since it presents these risks of late sequelae for the infection, it's a lot more damaging, and it might be worth risks from the vaccine. So how effective is the vaccine? Again, like I said earlier, that depends on your adherence to vaccine protocol. If you've only received one or two of the vaccines, I say you, I mean your dog. If your dog has only received one or two of the vaccines, efficacy has been quoted anywhere from 49 to 89%. And after the third, that goes from, or that's been quoted as anywhere from 79 to 99%. But again, no vaccine is 100% effective. And then, so the biggest one for Lyme is how safe is the vaccine. So Purdue, Texas A&M, and Banfield Pet Hospital did a study to see how often vaccines actually do have adverse effects. And Lyme was number one on there with 43.7 out of 10,000, which is a 0.44% of adverse reactions to vaccines administered. It was 30,000 doses administered gave this number. In relation, or for a little bit of perspective on that, the lowest was Bordetella at 12 per 10,000, and the highest was rabies plus Lyme administered at the same time, and that was about 53 per 10,000. So while Lyme disease vaccine is objectively the most dangerous vaccine, these are still incredibly small numbers. And then what is the potential for zoonosis from a dog? Like I said earlier, it is almost none because it can't be transferred in blood, bite, or fluid. But if your dog carries in a tick, then that could eventually bite you. These are my references. Some of them are really great.
Wow, you opened up such a big can of worms. Making vaccines. Just huge. And then you concentrate on Lyme, but oh my gosh. I know people, I noticed one state was Wisconsin. My wife's from Wisconsin. We have a lot of friends from Wisconsin. Yeah, show that map up again. And this one woman that I know had Lyme disease, but nobody could diagnose it. I think she went to like 10 physicians. I'm tired. You know, when you have it, you don't know that you have it, right? She was diagnosed with depression. Oh, I mean, just the whole thing. Finally, the 10th physician diagnosed Lyme. By this time, it was years away. I know another married couple. They always went out a lot, did a lot of outside stuff. They both have Lyme disease, and their symptoms go like this. Sometimes the symptoms are terrible, sometimes they're not there, and it's like, you know, they've actually gone to a holistic physician where, I can't remember what they're given, but something very unconventional, you know. I'm not even sure if it's a physician, but somebody that's got, you know, something that treats, but it's really quite a bugaboo. And this thing about the dogs, if they're not using the right antigen, then you're not going to get effective. It's like when people get the flu vaccine and then later they find out they used the wrong antigens, they used the wrong viruses, and it wasn't as effective as last year. They tried to do multiple, but the whole thing of making vaccines is really incredible. And most of those were killed, weren't they? Didn't they say killed on those?
Yeah.
Killed means they had to do something to kill the antigen. And sometimes what they do to kill it brings on problems. Now, the only question I had, well, we're almost out of time, but what were the adverse reactions? Because you said there were adverse reactions, but you didn't say what that was.
Yeah, I meant to put that in the slide, but then I forgot.
See how I caught her on that one?
The vast majority of them are swelling at the injection site, especially because most of them include an adjuvant. So that was really common. Nausea and vomiting, diarrhea, the usuals. The special one for the Lyme vaccine is the Lyme nephritis, especially in those retriever breeds. So what happens is these circulating immune complexes, or the immune system attacks the bacterium and lyses the cell, which creates a bunch of itty bitty bits with antigens on them that are recognized, and they create tiny circulating immune complexes that will eventually get stuck in the kidneys.
Yeah, so they physically get stuck in the kidney.
And those complexes actually attract complement and neutrophils, which then start attacking the kidney tissue. So.
And that's another whole big thing, yeah, complement and neutrophils. Excellent.
It also causes polyarthritis, usually in the front limbs, but nobody knows why. It's just in the front limbs.
Okay, got it. One last comment, questions? Here we go.
Is the Lyme nephritis like an immediate reaction, or can it be a long time
Repeat.
later?
It's not one that you'll see within 3 days, like most studies will look for, but you'll see it within 2 to 5 months.
It takes a while to make those complexes and make enough of them where they're plugging into the capillaries of the kidney. But that's another great subject. It's really a bad thing. It really is. And everybody I've known that's had it, early on it was misdiagnosed because none of the physicians are keyed into it
I think it was
early.
like 70s when they actually started discovering it.
Right.
It was a whole bunch of kids in, I think, Massachusetts who suddenly got arthritis, and they sent a doctor up and he was like, oh, by the way, I found this.
Yeah, so that's serendipity. Again, something that was discovered that they weren't looking for. Okay, let's give everybody another round of applause.